Welcome to Healthcare. Today we're diving into a topic that's incredibly important for anyone living with diabetes. Did you know that taking the right vitamins and minerals can help manage blood sugar levels and improve your overall health? In this video, we'll be highlighting the top 10 vitamins and minerals that every diabetic must take. So are you ready to uncover these secrets? Let's dig in right now. And don't forget to hit that subscribe button so you won't miss out on more valuable information. Vitamin A, a true beacon of hope for those navigating the turbulent waters of diabetes management. This fat-soluble vitamin, found abundantly in foods like carrots, sweet potatoes, and leafy greens, isn't just a nutrient, it's a powerhouse that helps combat the oxidative stress often exacerbated by diabetes for individuals with diabetes. The body's inability to effectively use insulin leads to elevated blood sugar levels, which can generate a flood of free radicals. These unstable molecules wreak havoc on cells, propelling the onset of diabetes-related complications. Here lies the heroism of vitamin A. Its antioxidant properties are not just a line of defense, but a formidable force that neutralizes these harmful free radicals, protecting the body cells from damage and reducing the burden of oxidative stress. Vitamin A, particularly through its precursor, beta-carotene, can influence insulin sensitivity, an essential factor in managing diabetes. Insulin, the hormone that regulates blood sugar levels, works more effectively in a body well stocked with vitamin A. This not only helps in maintaining glucose level, but also mitigates the risk of long-term complications, giving individuals a fighting chance for a healthier life. Diabetes can compromise the immune system, leaving one vulnerable to infections and slower healing. Vitamin A steps into this breach to fortify the immune system. It enhances the function of white blood cells and maintains the integrity of mucosal barriers essential in protecting against infections. This support is crucial for those with diabetes, where even a simple infection can escalate into a serious health issue. Incorporating vitamin A into the diet isn't just recommended, it's a delight. Nature offers us a palette of vibrant foods rich in this vitamin: carrots and sweet potatoes, a feast for the eyes and the body packed with beta-carotene. Leafy greens such as spinach and kale are not only low in calories but high in nutritional value. Eggs and dairy products provide retinol, the active form of vitamin A. Oily fish, a dual benefit of omega-3 fatty acids and vitamin A. If you or someone you know is battling diabetes, consider vitamin A as a part of your dietary arsenal. Vitamin B plays a pivotal role here, due to its profound impact on energy production and nerve health for individuals battling diabetes. Maintaining optimal levels of vitamin B is essential for preventing peripheral neuropathy and other complications associated with this metabolic disorder in both type 1 and type 2 diabetes. Vitamin B deficiencies are common and can lead to severe complications. Deficiencies can manifest as peripheral neuropathy, characterized by nerve damage that causes pain, numbness, or weakness, particularly in the hands and feet. Vitamin B1 or thiamine is particularly significant for individuals with diabetes because it helps prevent the accumulation of harmful byproducts caused by high blood sugar levels. Research indicates that thiamine can also enhance kidney health, reducing the risk of diabetic nephropathy, a common complication of diabetes that can lead to kidney failure. Vitamin B12 is vital for maintaining healthy nerve cells and red blood cell production for those with diabetes, especially patients treated with metformin, a common diabetes medication. The risk of vitamin B12 deficiency is significantly higher. This deficiency can lead to further complications, including severe neuropathy and anemia. It's why routine evaluations for vitamin B12 levels are recommended for those on metformin. Vitamins B6 and B12 are often referred to as neurotropic B vitamins. They aid in the function of neurotransmitters that help signal between the brain and the rest of the body. Adequate levels of these vitamins are crucial for preventing or managing neuropathic pain and other neurodegenerative symptoms associated with diabetes. A balanced diet rich in whole grains, lean meats, eggs, and dairy products can provide most of the necessary B vitamins for vegetarians or those on restricted diets. I recommend fortified foods or supplements, particularly for vitamin B12, which is primarily found in animal products. Monitoring and supplementation might be necessary. So consulting with a healthcare provider is crucial. Magnesium if you have diabetes or are at risk of developing it. You've likely heard about the importance of monitoring blood sugar, insulin sensitivity, and overall metabolic health. But have you ever considered the role that magnesium plays in this process? This essential mineral is often overlooked, yet its impact on diabetes management and prevention is profound. Magnesium is involved in over 300 enzymatic reactions in the body, including those that regulate glucose metabolism, insulin sensitivity, and cardiovascular function. Studies have shown that individuals with low magnesium levels are at higher risk of developing 2 diabetes, while those who already have diabetes may experience better blood sugar control by optimizing their magnesium intake. So how exactly does magnesium benefit people with diabetes? Magnesium plays a crucial role in insulin signaling, ensuring that insulin effectively transports glucose into cells for energy. For individuals already managing diabetes, magnesium supplementation has been shown to improve blood sugar regulation by increasing glucose uptake into the cells. Magnesium has powerful anti-inflammatory properties, helping to reduce oxidative stress and inflammation in diabetic patients by lowering markers like suractive protein and improving endothelial function. Magnesium contributes to better cardiovascular health. Magnesium supports heart and kidney health, regulates blood pressure by relaxing blood vessels and improving circulation, reduces the risk of kidney disease by lowering excess blood sugar and reducing oxidative damage to kidney cells, prevents blood clots by maintaining proper blood flow and reducing arterial stiffness. Did you know that people with diabetes often struggle with poor sleep quality and high stress levels? Magnesium helps produce GABA, a neurotransmitter that promotes relaxation and deep sleep. It reduces cortisol levels, helping to manage stress and anxiety, which can negatively impact blood sugar control. It improves sleep duration and quality, leading to better overall metabolic health. The best way to maintain healthy magnesium levels is through dietary sources. Here are some magnesium-rich foods that people with diabetes should consider incorporating into their diet. Nuts and seeds, almonds, cashews, pumpkin seeds, chia seeds, leafy greens, spinach, kale, collard greens, leang, UMES, black beans, lentils, edamame, whole grains, brown rice, quinoa, oatmeal, fatty fish, salmon, mackerel, fruits, bananas, avocados, dairy, low-fat yogurt, milk. Should you take magnesium supplements? For those who struggle to get enough magnesium through diet alone, supplementation may be beneficial. Magnesium is available in several forms, with magnesium glycinate, citrate, and chloride being the most easily absorbed by the body. However, it's important to consult with your doctor before taking supplements, as excessive magnesium intake can lead to digestive discomfort, low blood pressure, and potential interactions with medications. Potassium. Potassium is an essential mineral and electrolyte that helps regulate fluid balance, nerve signals, and muscle contractions. It works alongside sodium, calcium, and magnesium to ensure that the body functions efficiently. One of its most critical roles is in maintaining glucose homeostasis. The pancreas relies on potassium to effectively produce and release insulin, the hormone responsible for moving sugar from the bloodstream into the cells. When potassium levels drop too low, a condition known as hypokalemia, insulin secretion decreases, leading to higher blood sugar levels and an increased risk of diabetes-related complications. Individuals with low potassium levels tend to have higher insulin resistance. Insulin resistance occurs when the body cells do not respond well to insulin, forcing the pancreas to produce more of it to keep blood sugar levels in check over time. This can lead to type 2 diabetes. A deficiency in potassium means that glucose remains in the bloodstream rather than entering the cells for energy, causing prolonged periods of high blood sugar. This not only exacerbates diabetes but also increases the likelihood of developing serious complications such as nerve damage, kidney disease, and cardiovascular problems. For those managing type 1 diabetes, potassium becomes even more critical. Diabetic ketoacidosis (DKA), a life-threatening condition caused by a severe lack of insulin, often leads to dangerously low potassium levels. When insulin therapy is administered to reverse DKA, potassium levels can drop even further, necessitating careful monitoring and supplementation. This highlights the delicate balance of potassium in diabetes management. People with diabetes are at a significantly higher risk of developing heart disease and kidney disease. Potassium plays a protective role in both cardiovascular benefits. High blood sugar can cause damage to blood vessels leading to hypertension and an increased risk of heart attacks and strokes. Potassium helps relax blood vessel walls, reducing blood pressure and lowering the risk of cardiovascular complications. Kidney protection. The kidneys filter potassium, ensuring that its levels remain stable. Diabetes-related kidney damage. Diabetic nephropathy can impair this function, leading to potassium imbalances. Potassium. Rich diets may slow the progression of kidney disease in diabetic patients. To maintain healthy potassium levels, focus on natural sour sources such as fruits, bananas, oranges, kiwis, apricots, vegetables, spinach, leafy greens, mushrooms, sweet potatoes, legumes, lentils, beans, chickpeas, dairy products, yogurt, milk, fish, Ceylon tuna. The recommended daily intake is 200-600 ml for women and 300-400 ml for men. However, this should be tailored to individual health conditions, especially for those with kidney issues, as excessive potassium hyperkalemia can be dangerous if you have diabetes. I encourage you to prioritize potassium in your diet. Vitamin C. People with diabetes experience elevated levels of oxidative stress due to persistent high blood sugar levels, which can damage cells and tissues throughout the body. Vitamin C, with its potent antioxidant properties, helps neutralize harmful free radicals, thus protecting tissues from damage. Moreover, its anti-inflammatory capabilities are vital in reducing the systemic inflammation, often associated with diabetes, helping to stave off complications that could arise from unchecked inflammatory responses. Vitamin C has shown promising results in reducing fasting blood glucose levels and glycated hemoglobin HbA1c, which is crucial for the long-term management of blood sugar levels in people with diabetes. It enhances insulin sensitivity, meaning the body can use the available insulin more effectively to reduce blood glucose levels. Cardiovascular complications are common in diabetes, largely due to the damage high glucose levels can inflict on blood vessels. Vitamin C helps by strengthening the vascular walls and improving endothelial function, which is critical in maintaining the health of blood vessels. Additionally, its ability to lower blood pressure is another feather in its cap, further protecting the heart and ensuring overall cardiovascular health. Citrus fruits like oranges, lemons, and grapefruits, as well as vegetables like bell peppers, broccoli, and spinach, are all excellent sources of vitamin C. Incorporating these foods into daily meals not only boosts vitamin C intake, but also provides a host of other essential nutrients beneficial for diabetes management. While vitamin C supplements can be beneficial, especially for those who may not get enough from their diet, it's important to consult with a healthcare provider before starting any new supplement regimen. This ensures that the supplement will not interact adversely with other medications and is appropriate for your specific health needs. Vitamin D. Vitamin D, often celebrated as the sunshine vitamin, is essential, not only for bone health but also as a significant ally in the management of diabetes. Vitamin D can enhance insulin sensitivity, thereby reducing insulin resistance, which is a hallmark of type 2 diabetes. This can lead to better control of blood glucose levels and a reduced risk of diabetic complications. Furthermore, because diabetes increases the risk of cardiovascular diseases, vitamin D's protective effect on the heart and blood vessels is particularly beneficial. The primary source of vitamin D is sunlight exposure, which stimulates the body to produce vitamin D naturally. However, food sources such as fatty fish, salmon, tuna, mackerel, fortified dairy products, egg yolks, and certain mushrooms can also boost vitamin D levels for those with limited sun exposure or dietary restrictions. Supplements might be necessary. Embracing adequate vitamin D levels is more than a supplementary aspect of diabetes care. It is a foundational strategy that supports overall health and wellness. Vitamin E. Vitamin E acts as a protective shield, its antioxidant prowess safeguarding cells from this damage. This protection is not just about preserving cell integrity, it's about enhancing the quality of life for those with diabetes. People with diabetes are at a heightened risk of developing cardiovascular diseases. The walls of their arteries are battlegrounds facing the dual threats of glycation and oxidation. Vitamin E intervenes as a peacekeeper, preventing the oxidation of cholesterol, particularly LDL cholesterol, which is a precursor to plaque formation. By guarding the integrity of blood vessels, vitamin E helps reduce the risk of heart attacks and strokes. By improving blood flow and protecting against oxidative damage, vitamin E soothes the painful symptoms of nerve damage and shields the kidneys from deterioration, a silent commitment to preserving the body's filtration system. Chronic inflammation is a lesser known but critical aspect of diabetes that exacerbates insulin resistance and complicates blood sugar control. Vitamin E steps in as an anti-inflammatory champion, calming the fires of inflammation and helping to restore insulin sensitivity. This role is pivotal, not just in managing day-to-day symptoms, but in preventing long-term metabolic derailments. Embracing vitamin E's benefits involves more than just taking supplements. It's about weaving it into a comprehensive diabetes care plan. This nutrient can be seamlessly incorporated into a diet rich in nut seeds, whole grains, and leafy green vegetables, all foods that offer a bounty of health benefits. Beyond vitamin E, vitamin K. While vitamin K is typically renowned for its role in blood clotting, it plays several other vital roles that can significantly enhance the quality of life for those with diabetes. Vitamin K is pivotal in synthesizing proteins that aid in blood clotting and building strong bones. This dual role is particularly crucial for individuals with diabetes who often face heightened risks of bleeding due to various medications and increased susceptibility to osteoporosis. By maintaining adequate vitamin K levels, patients can ensure that their body's natural healing and bone-fortifying processes function optimally, thereby preventing excessive bleeding and strengthening their skeletal system. Recent research has illuminated vitamin K's role in glucose metabolism, a revelation that has transformative implications for diabetes management. This means that the body can more efficiently use insulin to lower blood glucose levels, reducing the burden on pancreatic beta cells and helping to maintain stable blood sugar levels throughout the day. Integrating vitamin K into one's diet is a simple yet effective step toward better health. Foods rich in vitamin K, such as leafy green vegetables, certain vegetable oils, and fermented foods should be staples in the diet for those considering supplementation, especially individuals on blood-thinning medications. A consultation with a healthcare provider is essential to tailor the right approach to vitamin K intake. Iron is pivotal for hemoglobin formation, the protein in red blood cells that carries oxygen throughout the body. For individuals with diabetes, maintaining proper iron levels is not just about avoiding anemia. It's about supporting the entire metabolic system that's already burdened by the challenges of glucose. Manage agement in diabetes, where glucose metabolism is already compromised. Iron's role becomes even more critical. Research has shown that sufficient iron levels can help enhance insulin sensitivity and mitigate insulin resistance, two pivotal factors in diabetes management. People with diabetes are particularly susceptible to iron deficiency for several reasons, including potential dietary restrictions, inflammation or loss of iron through kidney damage associated with diabetes nephropathy. Iron deficiency in diabetes can lead to further complications such as reduced oxygen transport and worsening fatigue, which can significantly affect life quality. However, the relationship between iron and diabetes is not straightforward. While iron deficiency has its risks, iron overload can be equally detrimental. Excess iron can contribute to increased oxidative stress and inflammation, exacerbating insulin resistance and the risk of complications like cardiovascular disease. This delicate balance makes monitoring iron levels and supplementation a nuanced aspect of diabetes care for individuals with diabetes. It's crucial to regularly monitor iron status as part of their routine health checks. Here's how you can manage iron levels effectively. Dietary management. Incorporating iron-rich foods such as lean meats, seafood, beans, dark leafy greens, and fortified cereals can help maintain adequate iron levels for vegetarians or those with dietary restrictions. Options like lentils and spinach are beneficial supplementation. Cautions: iron supplements can help resolve deficiency but should be used judiciously. Diabetes patients should always consult with their healthcare provider before starting supplements, especially since high iron levels can worsen oxidative stress and insulin resistance. Regular monitoring, routine blood tests to check ferritin and hemoglobin levels can help gauge iron status. Accurately adjustments to diet or supplementation can be made based on these results tailored to the individual's needs and the specifics of their diabetes management plan. Calcium. If you or a loved one are managing diabetes, this might be the missing piece in your health strategy. Did you know that older adults with diabetes are at a major risk of falls caused by hypoglycemia? Hypoglycemia is low blood glucose blood sugar, and when severe it can lead to serious health issues. Notable symptoms of hypoglycemia are feeling unbalanced, blurred vision, and confusion. Hypoglycemia can be caused by several factors, particularly the imbalance of food and diabetes medications. Falls in older adults with diabetes are a significant concern, impacting quality of life, independence, and the ability to enjoy daily activities. People with diabetes, especially those with long-term uncontrolled blood sugar levels, are at a high risk of developing osteoporosis and bone fractures. High blood sugar affects bone metabolism, making bones weaker and more prone to fractures. Why are people with diabetes more prone to bone problems? Increased calcium loss. High blood sugar levels can increase calcium excretion through urine, leading to deficiencies over time. Inflammation and bone weakness. Chronic inflammation associated with diabetes can negatively impact bone health. Reduced bone formation. Studies show that diabetes can slow down the production of new bone tissue, leading to low bone mineral density (BMD). How does calcium help protect bones in diabetic patients? Maintain strong bones and teeth by ensuring proper bone mineralization. Supports muscle function. Reducing the risk of falls and fractures. Prevents osteoporosis when taken in recommended amounts alongside vitamin D. If you are over 50 years old and managing diabetes, calcium supplementation might be necessary, especially if you are not consuming enough through your diet. If you want to increase your calcium intake, naturally focus on the following: calcium-rich foods, dairy products, milk, yogurt, cheese, leafy greens, kale, broccoli, bok choy, fish and seafood, salmon with bones, sardines, nuts and seeds, almonds, sunflower seeds, legumes and fortified foods, tofu, calcium set, fortified cereals and grains. Should people with diabetes take calcium supplements? For some people, diet alone may not provide enough calcium, especially if they have absorption issues or dietary restrictions. If you're not getting enough calcium through food, your doctor may recommend a calcium supplement. However, it's important to avoid excessive calcium intake, as it may increase the risk of kidney stones and interfere with the absorption of iron and other minerals. If you decide to take a calcium supplement, make sure to pair it with vitamin D, as vitamin D improves calcium absorption. Warning: before taking any calcium supplement, consult your doctor, as excessive calcium may contribute to artery calcification in people with heart disease. If you found this video helpful, please remember to hit the like button. It really helps us bring you more valuable content. Drop a comment below and let us know your thoughts, questions, or what topic you'd like us to cover next. We love hearing from you. Of course, hit the subscribe button and turn on notifications so you never miss out on our latest health tips and insights. Stay informed, stay healthy, and we'll see you in the next video.